My name is Zabeen Mahuwala. I'm an assistant professor of neurology at the University of Kentucky. I see patients in an inpatient setting as well as in an outpatient setting. So my clinics would have patients with seizures, seizure disorders. It could have specialized population of patients with pregnant women, women of childbearing age. Could be elderly, with patients with stroke, children who are adults and with special needs. Or it could be just difficult to treat epilepsy patients who are needing surgical evaluation to possibly help them cure their epilepsies. Many times when we do these surgical evaluations, we may not be able to offer surgery, but then we are able to offer palliative things like devices, vagal nerve stimulators, deep brain stimulators. So a variety of things to offer these patients. And that's basically my role in the division of epilepsy. My parents cared for my grandparents. One of them had Alzheimer's, and the other one was disabled with a stroke. So I know the importance what doctors played in our lives to help us understand these diseases and the kind of care we could offer them once we knew about these diseases. That played a very important role in my life to keep me going and pursuing this dream of being a doctor and serving the community. I love the field of clinical neurophysiology. It deals with patients with seizures, could be from epilepsy, and it also deals with neuromuscular medicine, which treats neuropathies, myasthenia gravis, ALS, and diseases which are pertinent to neurology. I felt that I could cure a lot of patients with these conditions. Some of them have a cure, some of them don't, but at least you can make it less disabling. I always want to give back the community what I got from them. So I've had 19 years of experience in the field of medicine from the time I started training till now. And I always want to make my care patient-centered. And so I try to talk to them, discuss with them their disease, the burden of the disease, the various approaches, and try to help them make a decision to make a best choice for them.